In my skin center, I often get the question, where exactly should I apply my eye cream? Now, again, as being part of the beauty industry for many years, I know we've always said to people, put it on the actual bone around the eye area. Now, in the older days, maybe the ingredient technology was not quite what it is today, and there potentially could have been harmful ingredients in the actual formulation, and therefore it wasn't really good to put on the eye area. Often also, if the cream was very thick and rich, it could actually lead to a puffy eye area. So with modern technology, with the great invention of peptides, anti-aging ingredients, vitamins, hyaluronic acid to hydrate the eye area, shea butter that also hydrates the eye area, beautiful silicones that's available, we now suggest that you put it on the actual eyelids itself, right underneath the bottom lashes, on top of the top lashes, all the way to underneath the eyebrow. Is there a specific technique? I know some people say you need to take your ring finger and tap it on. Quite frankly, who's got the time? I just take any finger as long as it's gentle. Don't apply a lot of pressure, and you could just rub your eye cream on that eye area until it actually has absorbed into the skin itself. When you go looking for an eye product, look for something that's good for your lifestyle. So is it that you want to treat anti-aging? Is it that you want to treat puffiness? Is it that you want to treat dark circles? Or maybe all of it together? So I would always recommend to look at an eye cream that kind of looks and treats everything. You know, often there is ingredients that helps to reduce water retention, which is often good for the puffiness. And then there's some ingredients that actually breaks down the iron buildup underneath the eye area, which is good for the dark circles. Dark circles is very much a genetic thing, so not necessarily that you're going to get rid of it completely. There's great mesotherapy techniques that your doctor can do for you, where they inject a cocktail of ingredients to actually break up that iron buildup. There's also some eye creams that you can then use while doing the treatment with your doctor. For the wrinkles and puffiness, what I often suggest is microneedling treatments. We needle right underneath the eyebrow, we needle right underneath the actual eyelashes at the bottom. We can also do some TCA or trichloroacetic acid peels on the eye area with great results for the fine lines for the wrinkles. And then don't forget, your lifestyle also affects the puffiness of the eye. So if you have a high sodium intake, I find often when people have alcohol and maybe a lot of spicy foods, all of that could lead to puffiness, sometimes make the dark circles look even darker. And of course, a lack of sleep could very much affect the dark circles under your eyes as well. So there's many great treatments for the eye area. Please start using an eye cream as soon as possible. Many people say, oh, so start at the age of 25. You know, quite honestly, from the day that we are born, we start aging. Not to depress you all, but as soon as you can, start using something for the eye area. And again, moisturizer formulations are so fantastic these days that many of them can be used on the eye area. But check with your professional skin therapist or with your medical practitioner to make sure that it is suitable for the eyes. I'm not a big fan of putting high concentrations of retinol on the eye area, high concentrations of alpha and beta hydroxy acids, because I have found that my eye area becomes quite dry and irritated, although those are great anti-aging ingredients. But with care at a low concentration, you probably find that your eye area is absolutely fine. There's some sunscreens, like I'm quite prone to irritation from a chemical sunscreen, so I can never put a chemical sunscreen too close to my eye area, but I can, however, put a physical sunscreen like a titanium dioxide or a zinc oxide. Now, there's also some people that battle with what we call milia around the eye area. They look like small little round white balls. Now, those white balls, if as a professional I lance them, I can actually pop them out. It looks like a small pearl that we pop out of the skin. Now, again, some people hereditary are just more prone because of genetic compounding to milia in that specific area. However, often it is caused by using a mineral oil-based eye makeup remover. So a mineral oil-based eye makeup remover that you move around, you remove the makeup, you then rinse it off, that can't often be removed from the eye area properly, irritating the eye, having an occlusive effect, and therefore lead to the milia. Can be very safely extracted by a professional skincare therapist with a machine that we have, but we can also do it by hand if we've been, if you go to someone that's been taught correctly how to remove that without bruising the eye area. But try and avoid it. So stay away from a mineral oil. You can maybe just use a light water-based type of gel or a light creamy type of cleanser even to remove the eye makeup. So hopefully this has helped you a little bit to look after your eye area. Start as soon as possible. Look out for nice peptides, hyaluronic acid, shea butter to moisturize that skin, loads of great vitamins, and then you'll have a great eye area moving forward.